Live. So welcome everybody. Excited that you're here on our third informational webinar. We're actually calling this one more of a forum because we're anticipating and hoping for interaction and discussion. My name is Todd Abbott. I'm the director of the Albany Chamber of Commerce. We have some folks from the city here. I see Vice Mayor McQuaid is here. She'll just be joining us for a little bit. We know she's got another meeting to attend. I see Claire Griffin from the city of Albany is here. There she is. Very good. Welcome, Claire. We have folks from the Solano Avenue Association. There's Alan Kane, who some of you may know, by reputation at least, the executive director of the Solano Avenue Association. I'm also seeing some other directors from the SAA, Peggy Smith, Richard Smith. We're very happy you're all here. And I think that's all I'm going to do for introductions. So I want to now introduce our facilitator, speaker and facilitator today, Suzanne Frew. Suzanne is the president and founder of the Frew Group. And she has been working, I didn't know if I should say many years, lots and lots of years, well, a long time. She's been working with communities, helping them prepare for emergencies, but then also helping them respond and recover. With quite a bit of experience helping business, in particular small business, recover, and not wanting to again date anybody, but she did a lot of work with the SBA during the Northridge earthquake some time ago. So with that, I really would just like to hand it over to Suzanne and take it away, Suzanne.
Great. Okay. Thank you, Todd, and thank you, Alan and Claire and Peggy and everybody who's invited me to join today. Really glad to be here. What I thought we could do was start off by, I would love it if we could just, if there's anybody who wants to add in their thoughts at any point. This is really intended to be a discussion forum, not a presentation. I'm going to present some information. But again, this is the idea of this forum is so we can kickstart our ideas to really figure out how to start resetting and getting back into our businesses and getting and really focusing on where do we go from here. It's been a rough time for many of us who are small businesses. I also am a small business here in Albany, and we've all gone through the ups and downs. And so the purpose of this next hour or so is that we get to think about some things. And I've got some facilitation questions, and I'll first talk about talking about what resources are there and how to approach those resources. Then we'll take a few minutes and we'll start, I'll present some ideas for consideration, like what could we be thinking about that's very, very helpful as we start this process to get back into a more normal. If we think about what this new normal looks like, and I'm going to give about 6 points that I'm really going to invite you to consider for getting back into this, going back into business and lifting up that business in a healthy way. And then we'll take about 30 minutes or so, and we're going to have some discussion. We're going to talk about, we've got some 4 questions. And we're going to go through those discussion questions. And this is not a time for me to present. This is a time for me to basically hold a space where we can actually consider what some of this might look like. And what we want to do is we want to invite everybody to talk about their own business, to talk about what they're doing. And we're going to go over 4 different subject areas. And it's really a time for sharing, and it's a time for brainstorming. And then we'll close out today, our discussion forum today, by we're gonna look to you and say, you know, what is it that the Chamber and the Solano Avenue Association and the city, how can they be of assistance to you in your walk, in your work with your business? And then we'll take a look, and then we'll close out today by taking a look at looking towards the future. You know, what does that look like? So at any point, this is extremely informal. The whole point of this is a facilitated discussion. It's not a formalized presentation. But we want to really invite you to join in. You can unmute yourself, and you can join in and make a comment, because we are definitely inviting comments all throughout today's online forum. So that makes sense. Does anybody have anything that they would like to share at this point?
I do want to jump in real quick, and just something that we had mentioned that I was going to mention that I forgot to mention, and that is, folks, we recommend you get a piece of paper and a pen or something. Just jot down some notes or some questions as we go along. You're free to jump in at any time, but you may still want to, jot it down and then return to it later. Sorry, go ahead, Suzanne.
Oh no, that was great. I realized that Todd and I were talking beforehand and said it's really important. We definitely want to encourage you to because we're going to be inviting you to discuss about some things, and then I'm going to be making some points that just really inviting you to consider on this path. So let's first talk about resources. We're just going to spend a few minutes. We're going to talk about there is a lot of resources out there. For sure, there's resources. It can be really overwhelming. So what I'm going to really encourage you to do is thinking about the business that you're in, whether you're in a restaurant, whether you're in retail, if you're in real estate, whatever it is that you're in, thinking about what those resources are that really focuses on your industry. So the real focus is be local first. Look at what's going on for you that can really impact you here in the city of Albany. And then stepping out one step further, looking at the county, looking at Alameda, figuring out what's going on for the county. Then going out a little bit further, then that could be the state of California, looking at what resources are out there, and then looking at the federal level. We've all had eyes on what's going on at the federal level. Just be aware that those resources are changing all the time. They're updating pages, they're adding, they're changing what's out there. So just be aware that resources are changing. Second point I'd like to make is, when you're doing that, be really specific about your search. Just don't go out there and say, oh, I'm going to look and see what's new. Be very specific to your industry. Be very specific even to a question that you might have. That's going to help you not go into the third point, which is really going into overwhelm. Because right now, with what's going on with COVID, and since we don't have a good sense of where we're going to be going from here, it's so easy to go down that rabbit hole, especially when you're online and when you're on the internet. So be really specific about your search. So in doing that, it's going to keep you from going into overwhelm about those resources that are out there. And when you're finding those resources, don't be afraid to ask questions. Going to really invite you to put some questions out there, whether it's on that website, whether it's to a contact information. And if it's something is confusing, get clarity on it. So I'm bringing that up, and then I'm also going to say, the city of Albany has done an extremely good job under Claire's supervision with this, of putting out an Albany page for COVID and for businesses that are working during this time. And we really want to invite you. We've been putting that out. The chamber has been putting that out, and Todd just put it up on the screen. That's this right there that you can see. That's thank you, Todd, for putting that up there. So it's businesses and worker resources, and it's a very, very rich resource. Don't be afraid to go through it, then you can dive deep. But we really worked hard to pull a lot of resources together and organize them in a way that would be self-explanatory. But if you have any questions, do feel free to reach out and to ask if you've got any questions. So that's what I wanted to bring up about the resources. But I would now like to open it up. And Todd, if we could unmute everybody. I know that Rochelle and some others have joined us, Lisa, Andrew. If we could, taking a look, and has anybody found a particular resource that they found particularly helpful. And we're really going to invite people to for those of you who are on the call from your different organizations,
Yeah.
if they found it, if you could say what your industry is and what those resources are that you have found.
And folks, if you are muted, feel free to unmute yourselves at any time. Depending on your settings, you may be able to just press the space bar and unmute yourself temporarily.
And Todd has put in the group chat. He's put in what those resource page is from the City of Albany. So for those of you who are on the call, what resources have you been using? Just want to see if there's anybody who's gotten anything that's really been good. And Todd and Alan, I would also invite you to say something that you might have found as well.
This is Andrew. Hello.
Hello, Andrew. Thanks.
Psychologist, long-term practice on Solano Avenue with a group called the Solano Center. So I'm representing our group, which is an essential service. We've had one or two people that have continued to work, but most everyone, and we have a couple of dozen clinicians collectively that work out of our offices, most everyone has been staying away. But we also are building owners, 3 buildings right at the corner of Solano and Curtis. So we're wearing 2 hats and trying to manage. I would say one resource that has been helpful, Alameda County, I guess, Health Department, but they had put out a suggestion a month ago about needs for PPEs, and we wrote back and they did provide us. We had to pick it up in Livermore, but they provide us with several hundred masks as well as disinfectant solutions. So it's really a help in getting started. And we're creating a COVID protocol to give people some guidance about coming back. But each person is individually licensed. They're not employees of ours. So we just want to give some guidance. So whatever other guidance you can provide about safety in terms of coming back to work as people do.
Andrew, that's fantastic, because that's going to be one of our questions today, and I'm going to really invite you to come back to that and when we get into those discussion questions. So thank you for bringing that up. Could you remind us again what the website was that you were? It was the Alameda County, and it was the.
I believe it's the Health Department. I would have to look it up and then send it to you. If it's not that, and you can forward it to folks.
Sure.
And just to say ahead of time, I actually have a patient at 3, so I'll be leaving at 3.
Okay.
And I may not be in the office, but I'm working more than ever. As you can imagine, people are really in need of mental health services right now. So.
Well, thank you for what you do. We really appreciate it.
Thank you.
Thank you. Michelle, I think that you had popped on to say something.
I did. Well, actually, you asked the question already. I wanted to know the resource that Andrew had utilized. And so I'm glad you already asked it. It's helpful.
So it sounded, Andrew, like you had said the Alameda County Health Department. So Andrew is on mute, but that I think I had jotted that down. And Todd, you might have gotten that as well.
I believe that was it, but I will look it up before I go offline and put it in the chat.
Sure.
Thank you so much.
Thank you.
So Andrew, are you considered a healthcare facility?
Solano Center is, yeah.
So you are, okay. I'm looking at the
specifically exempted, under the requirement, the shutdown.
Oh, sure. No, I was looking at the Alameda County Emergency Services and a request for PPE, and it is for EMS providers and healthcare facilities.
Okay. Well, that's it.
Yeah. I did post that link into the chat.
Thank you.
Sure.
Great, thank you. Michelle, was there anything, or some of the others, is there any other anyone has found a particular resource that you have found particularly helpful? I see we've got some callers on the phone, so don't really know who those individuals are, but very much invite you to unmute yourself and share any resource that you found. Okay. Well, again, if you don't have any particular resource, for sure, going back to that Albany page, the city's done a really excellent job of combining a lot of different types of resources. Also on the county, they are working very hard. The Small Business Administration, Todd or Alan, help me out here. The
SBDC.
SBDC, yes.
ACSBDC, the Alameda County Small Business Development Center.
Yes.
It's an arm of the SBA, and
Yep. So they've been working very hard, having webinars and putting resources up. Alan, looks like you were going to chime in on something.
I mean, I could. We've, if I can have the air for a minute. We've taken a multifaceted approach. We're looking at this. We have two different things that we're looking at. We're looking at ourselves here organizationally, and then we're looking at ourselves figuring out what we're going to do in terms of our public events, which is kind of a key fundraising factor for us as a nonprofit. And locally, Berkeley has their own health department. Of course, Solano Avenue includes Albany and Berkeley. And so we've kept our eyes not only on the Albany website, but the City of Berkeley's website. And we escalated it out to the county level, the county health department, which of course actually has jurisdiction right now over everything. They're the ones that actually issued the shelter in place. They're the ones that regulate what phases that we follow from the governor's office. And so we've paid attention to the Alameda County SBDC as well as the health department. Then the next step up that we've been paying attention to is the governor's office. Of course, he's created the four-phase roadmap to recovery, etc. And on the federal level, we've been looking at them in terms of money and loans and that kind of thing. But in terms of actual information or practical information, knowledge, we don't find the federal government at this time to be helpful for businesses. And so we've focused on the county and city levels and state levels. In terms of the event that we produce, it's the Solano Avenue Stroll. It's in September. Obviously, there are lots of events that have delayed or canceled. What we're doing in terms of our events is we're looking internationally at what Disneyland is doing in Bangkok and Tokyo. And we're watching NHK News, which is a news program out of Japan that includes a lot of international news. So we're looking to see what Italy's doing as they reemerge from all this, what Japan's doing as they reemerge from all of this. And then locally, we're looking at Cal football. The biggest partner that we have in terms of our regional event is the Cal Stadium, who is already planning for practices and a season. So we have our eyes everywhere and our mouths closed for the most part. And it's just really interesting to see how things evolve daily. And that's why we recommend people just stick with the city, state, and local, resources.
Great. Thank you. Great. Appreciate that. It's good to know, interested on the Cal Stadium, who all you're looking at. All right, what I'd like to do now is move us to the next segment, which is just very briefly, what I'm going to do is have some encouragement for you in hitting the reset button for your business. That's what this is really focused on. What's hitting that reset button? Some ideas for consideration. And as what Todd had said earlier, having a pen and paper might be very helpful, and we really invite you to just jot some notes down if something really sticks with you. But this is basically built on when you have business continuity, when you're trying to restart a business or you're trying to pivot in your business, here's some ideas to consider in doing that. First, as you're starting to go back in to look at what you're going to do with your organization, one of the first things to think about is to have an extremely clear organizational structure. So whatever this organization is that you're working with, whether it's a school, maybe Michelle's with the Chinese Learning Center, or maybe with some of the others, some of our others that have joined us, thinking about what that organizational structure is and how that might need to change. But being very, very clear on that right now is very important as you start looking at what some of the things that we're going to talk about in a few minutes. The second piece of that is to make a plan for the staffing challenges that you're going to face. So Andrew was talking earlier about how they had the mental health essential workers. What are some of those staffing challenges? And start thinking about identifying making a plan for those staffing challenges in case some of the workers aren't able to work, and they're not able to work for a variety of reasons. They might not be able to work because they are homeschooling, or if they do come down with the virus, that can be, or come down with something else. But having it where they're, putting that plan in place for those staffing challenges. So I really encourage you, that second point, to do that. The third point is we know that there's going to be a run on supply chain. The issues about suppliers and raw materials is going to be it's going to be tricky. And the thing is, we've got to get ready for it to be even more challenging as we go forward. So identifying alternative suppliers for your business, if you're based on something, if it's retail, whatever it is, for the suppliers, but also those raw materials that your business needs. We anticipate that those supply chain issues are going to break down more. So as we look at going forward, it's really important to do that. So alternative suppliers and raw materials. The fourth point I wanted to bring up was think about what your business might look like when your workers can start returning into the workplace, when we start looking at how do we open it up where we have more customer engagement, when we have more people there. But starting to vision now about what that business, what it's going to look like. So that's very individualized. It's based on what your own business is. And it probably will change. It probably will change. We don't know what the future is, but starting to map it out, whether visually mapping it or doing something else, thinking that. So that's having that vision of what it is moving forward. And what we're going to do is do some brainstorming today about what that could look like. The fifth point I wanted to make was, how are you going to stay afloat? How are you going to stay safe? Even if the social distancing measures are in place, how are you going to map out what that looks like? And how are you going to keep those folks safe? Every organization is organization by organization. So please do that. And then the last point is to reevaluate how you're going to do business. So when you start doing that reevaluation piece, and I'm going to put my headphones on. Can everybody hear me? Great, awesome. So as you start reevaluating your business, start writing down, note what has been working well. This is really important as you start looking at, and we are going to talk about that a little bit in a few minutes, but we're all going to have to keep on reorienting, reevaluating how we're going to do business. It might be telecommuting. We had Andrew talking about how the psychiatrists or psychologists there, how they were working with this. But writing down what's working well, what are some of, maybe there's been new marketing strategies, maybe it's been a new design, but documenting that and sharing that and vetting it within your organizational staff, extremely important. And just thinking about when you're doing that, how you're reevaluating your business, thinking about what might be different, documenting what might be different about your customer base, what might be different about your operational approach, and your service deliveries. So those are 6 key points that we really wanted to, just 6 ideas for consideration. So clear organizational structure, staffing challenges, identifying alternate suppliers and raw materials, and start thinking about what your business might look like when your workers start returning to the workplace, mapping out how you're going to stay afloat with these social distancing measures in place, and then reevaluating how you're going to do business, writing down what's working well and what's not working well, and then what might be different about your customer base. So those are 6 key pieces that I just wanted to present. Does anybody have any particular thoughts on that before we go into our discussion section? Anybody? And I know, Andrew, you might have been doing this already. So does anybody want to add anything? I mean, we really would like this to be a sharing forum, not a webinar presentation. Sean, one thing I would like to do is ask you if there's anything that you've been looking at for these types of ideas for Beacon Home Care. So he's looking intent. I'm not sure if he's hearing me ask.
I can say that I've been really impressed, I'd say, with some of the innovation I've seen, like restaurants that now sell groceries, restaurants that sell frozen meals rather than, so these are ways that they are trying to innovate. And for instance, I have a client who's fully intending to continue doing a lot of that when things do open back up, because they're finding that they're good at it and people like it. So they're planning to continue with that. So not only is it an opportunity to get you through this time, but it may expand your business later on.
Right.
Sorry, I was trying to get it to unmute. So, yeah, no, as we've been gathering feedback from our clients as well as our employees, and we've realized that certainly some of our clients' needs have changed, based upon their concerns. So we do primarily we provide caregivers in the home for senior care, and because people can't get out to shop, especially with our older seniors, there's more of a fear of going out, going to get the things that they need. So we've had to shift, from some of the long-term care aspects that we usually focus on, and really look at some of the short-term needs of our clients. So that's really been the biggest one. But I'll use that word everybody uses, is we were able to pivot, and we were able to discover, a whole new business segment for us. So it ended up being very, very beneficial to us.
Great. Thank you. Okay, I think it might be good to go into, unless anybody has anything, any other comment on those ideas for consideration. Why don't we go into some discussion questions? This is where we really wanted to focus on allowing people to add in their thoughts. And what I would like to encourage you to do, for those of you, there's quite a few of you who are there. If you have a phone, totally understand that. But if you have a camera that's available to you, it's really great. I'm spending a lot of time on Zoom calls and in classes these days, to turn on that camera so we can see you. It actually does add and actually builds more community. And so just really invite you, if you are comfortable. If you're not, that's absolutely fine. But if you're comfortable, to turn on the camera so we can actually be in as much as possible in community face to face. So if I just invite you to do that. So Todd, maybe it would be time to put up the, oh, hello, Richard. Thank you for joining us on screen. That's a great thing. And I know Michelle's been popping on and off, so it's great. It was great seeing her, and Andrew was on there. So I know he's going to be with us until 3 o'clock. So that's great. Todd, do you want to put up the questions? Oh, you're muted, Todd.
I am sharing the screen. Are you not seeing it?
Up here it is. Okay. Yep.
Yeah.
Thank you. Excellent. Can everybody see the question that we've got there? Okay, excellent. Hello, Rochelle. Nice to see you. And I see that the top of Linda's head popping up there, and she's got something that I wish I did have, which is a fan, which is great. You can share that fan, Linda. We would all really enjoy it right now. So the first question, and those of us who are on here, which I think is a basic question that everybody's looking at right now, is how can I reestablish cash flow? So those of you who are on the call, I'd really like to, again, this is not me giving answers because this is so unique to every individual. We really wanted to create a forum where we could do some brainstorming and one person making a comment that could potentially help someone else. So that's the idea of what this is for. So if somebody might want to take the lead, if anybody has had thoughts about how am I going to start off, how I'm going to reestablish cash flow, I would really invite you to join us and share what some of those thoughts are.
I can go.
Great.
So we are an after school and summer program. And so we closed our doors in mid-March, and we then offered our Chinese language classes online to our students, and we're still doing it now. Unfortunately, our revenue stream pretty much dried up at the end of April. You know, obviously because the kids aren't in our care and parents are homeschooling their children instead. But we felt it was still important to still provide a continuity for the kids and, you know, give them the opportunity to kind of still connect with their classmates. And so we continue to offer our online classes. But we've decided that we're going to reopen in time for summer. So, you know, the plan was always to open by mid-June and deliver, you know, 10 weeks of summer camp. And so that's how we're going to reestablish our cash flow. You know, you mentioned earlier about resources, and there's a lot of information out there, and obviously it evolves and it's always changing. And so just yesterday we had communicated to our, you know, our population of parents that we are going to reopen our doors. However, there's this new requirement in the county that in order to maintain a stable group of 12 children, you need to have them enrolled for at least 4 weeks. And so now we used to be you know, we want to provide flexibility and sign up for 1 week at a time. Now you have to commit to 4 weeks.
Wow. Okay.
And one of the parents wrote back and says, I'm so confused because I read elsewhere that as of June 1st, childcare is available to essential and non-essential families. Why are you saying that it's only for essential families? And so there's a lot. And then I shared with her the Alameda County public health, you know, information, and she sends me an article from Mercury News, whereas the information is just not, you know, not synchronized.
Right. Mercury News being San Jose. Yeah, exactly. Great, thank you. I would, Andrew, I don't know if you're still with us and available, but I was extremely interested in how the establishing of the cash flow that he had spoke about earlier. I thought it was quite interesting on, especially because there was probably an uptick in his service requirements during this, or the need for the services. And so I thought that was very interested in how they were trying to do that for people who are in the physical therapy. Oh, we've got a new one here. I love that. So great. Somebody else, how about how can I reestablish cash flow? Are there other ideas? I know we've got callers on the phone. I know we've got people online. I want to pause and just give you a moment. Richard, nice to see you. And if there's any thoughts on yours as well?
No, thank you.
Well, for us, it's not, we're a little different than some of the people on here because we are not technically closed. We work from home. So the cash flow, although less, hasn't been completely gone. So it's just, for us, it's just more starting to ramp up, getting customers back in the door.
Okay.
And I would say that for our part, we have been, you know, we've utilized the SBA resources to help us kind of smooth over the issue. So,
True.
You know, that way the cash flow never gets so bad that you're, ideally, now it's all ideal, but
yeah,
one of the things that we did.
Okay.
Any other thoughts there? We can move to our second question.
Yeah. One of the things that I always think about, in kind of establishing cash flow is to make sure that there's, cash on hand. So maybe renegotiating, certain terms, whether it be with your rent, whether it be with your credit cards, or whatever the case may be, your business expenses. Because again, it can be tough, it can be just as tough, if not worse, as all of a sudden there's an uptake in your business and there's not enough money to pay, employees or to pay for goods and services. So yeah, because you're, 30 days out waiting for a payment. So.
Oh, that's a good point. All right, why don't we go to our second question? So I think this is one that really deserves some attention, but how can I reestablish or recraft my customer base? So I don't know about the different individuals who were on this particular call, but that is something that across the country, people are starting to really look at and think about what could be different. So anybody want to share anything there? Michelle, I know you had talked about, having this 4-week mandated commitment versus a 1-week mandated commitment can really can impact the way you look, but maybe some others might have had some thoughts as well. Anybody else that might want to chime in for that? So for me, I'll just add in for me. So the customer base, a lot of my clients have been government clients. That's one of the, working with the government entities, and looking at how to reestablish that customer base could be looking at what they need to do differently. And that might be looking at if they're in a period of time where they're not able to, they're being hit hard with finances, maybe shifting over and just saying, looking at maybe there needs to be, a different customer base during the time of the emergency management piece. My work has been for years I've worked with local governments and state governments and at the federal level, but really looking at the issues of these economic impacts, looking at how do you get highly vulnerable populations there. Well, we know now that there's really big issues with the vulnerable populations. And so looking at, for me, it might be looking at, well, maybe I need to retarget some of my customer base who might be really looking at addressing the issues of highly vulnerable populations. So that's an example from my own experience. I don't know, Todd, if you've seen any differences in the whole web services.
Well, I would say that we're shifting focus a little bit, and really it's more of a marketing focus than a technology focus. But that's what we're talking about. We're talking about different ways of marketing to bring different people into your business, and we're shifting more towards kind of an e-commerce, online stores, kind of trying to react to this, environment, thinking, well, people are going to be trying to sell more things online that they normally would have sold out of the brick and mortar. So that's one way that we've kind of shifted. I'm not going to use the word pivot. I'm just not. But we've shifted. Not in circular, kind of sideways, pivots, so, but no, so that's the way that we're responding to a different customer base, or trying to appeal to a different customer base.
Anybody else have any thoughts? I mean, I know, Sean, you're out there working with, your customer base is, supporting individuals in their homes. I don't know if there's been any shift right there on how do you deal with your customer base differently.
Yeah, one of the things that we've kind of been doing is trying to use our customer base like organically, like getting in touch with our customers and asking them if they know other customers who are in similar situations that they can refer us to. So
great.
One thing that comes to mind is actually something I learned from a friend of mine who owns a body shop. when he went through the 2008 recession. And that was, they kept busy because they were kind of the fallback. Rather than buying a new car, people were fixing their old cars. So rather than moving to a new house, they might remodel the current house. Rather than remodeling, they might redecorate. I mean, there's all these different ways that it kind of shifts back. So maybe think like one tier up, right, of your kind of niche or your vertical, whatever, and consider those people now are more viable clients than they might have been before.
Mm-hmm. Yeah. Was somebody going to say something? I was going to add something in there. One of the things that I would say is that recrafting the customer base can really look different depending on what your business sector is. It might have to do with demographics. It might have to do with your age of your customer. It might have to do with where they are coming from. It might be traditionally the customer base was in the local neighborhood, but there might be something that might be done a little bit differently to draw a different customer base. So there's the question's really put in two parts. One is reestablish because people have drifted away. And so often that's really difficult. They go away. So Andrew, you had thoughts on that.
I just wanted to say, as building owners, our customers basically are clinicians that work out of the buildings, and we've created a protocol. We're sending out to them, staying in communication about what we're doing as owners to make the space safe. So I would suggest in general, if businesses could communicate with their customers and let them know what they're doing. People need reassurance now to come back in.
Yes.
And if you don't have a direct list of who your customers are, I would say post notices on the storefront. Let people know this is what we're about to do. Otherwise, folks are going to be guessing when is so-and-so opening. So that would be a translation of what we're doing at our end.
Andrew, are you all using social media very often?
No, we're doing email. I mean, basically, I think that's a great idea, but that's not something we're active in.
Okay. I don't know if some of the others are, but I know that there's been some communities that have really been focusing on expanding social media presence.
Right, and then individually, I communicate with my clients, my patients. And so for us, we encourage each clinician to do that because they certainly know what their customer base is. So we invite them to do that on an individual basis. We can't do that overall because of confidentiality.
Of course. Great. Anybody else have anything that they want to add on that? Again, looking to see that we do have some callers on the phone. Please feel free to chime in. So, Alan, anything you want to add in or nope? Okay. All right. Why don't we go to our third question, because I think this is where Andrew had touched in base with this, and I'd really like to invite some of the others who are on the call, Michelle or whoever, to add in this. How can I comply with the protection regulations? So this is getting pretty interesting, and there's three parts of this, the question. So how can I comply with, first, my employees, second, my operations, and third, my customers? So those are really different, those are three really distinctly different areas. And so that might require some different protection approaches. So has anybody been finding now, Andrew, I'd like, if you're there, I'd love to come back to that, because you had, I thought that was really impressive how you had gone out and reached out to the county and ensured your protective equipment and gotten support with that. So Andrew might be muted at this moment. Always the fun with Zoom. So
I'm not sure what you're asking, Suzanne.
Oh, you had asked for support from the county on your PPE, your protective equipment. And I was just wondering, has there been anything that you've looked at? We looked at the employees, the operations, and the customers. Is there anything, did you have any aha moments in there when you were dealing with compliance, on compliance questions or issues, or even moving forward, as you're moving forward now?
Yeah, well, we're suggesting to each clinician that they educate their client and discuss with them whether they have been symptom-free for 2 weeks, that they're fever-free before they're allowed in the building, that they wear a mask, and the same for the employees. And then we, as owners or operators in terms of the operation, do our best to have the waiting rooms and surfaces cleaned, regularly disinfected. And we also provide extra masks in the facilities. The expectation is that both clients / customers and employees have their mask, but we have extras on hand. So if somebody doesn't have it, we can provide that. That would be important, I would think, for any business.
Mhm. Thank you. Others? Sorry, now I have a cat that somehow got in the house. So we were talking about the cat bombing. Maybe the cat could leave the house. Alan, yours is very quiet and calm. So in any case, it's other people. So other.
This is actually, excuse me, this is actually an area that we worry about.
Yeah. Tell us more.
Pardon me?
Tell us about that.
Well, so, I mean, we have sort of stocked up, and we wouldn't go crazy, but we have, we have the sanitizing wipes. We have a lot of masks in case we have to give them to customers. We'll have gloves for the employees. We've got plastic sneeze guards on their desks. So when somebody's sitting there, they're not, directly, if they sneeze or coughed or anything, hopefully don't. Hand sanitizer when they walk in the office. But we still worry about, what our responsibility is if either the employee or someone gets sick. Even though, we all could be carriers and have no idea we are, apparently.
Mm-hmm.
And so that has been an area that we worry about. We haven't really found any good guidance on it other than just doing what we think, everything we can think of that we can do that's right. And then we'll see what happens, I guess.
Mm-hmm. Mm-hmm. Is there any particular guidance that you are really looking for? Anything in specific?
Well, I mean, you know how it changed when the guidelines were you didn't have to wear a mask if you didn't have symptoms, right? And then it said, oh, well, whoops, you need to wear a mask because you could get someone else sick even if you're not a carrier. That came later. You were told to wear gloves. Now they say, well, we're not so much worried about it being on surfaces anymore. Maybe not. So, we've been trying to come up with these guidelines, just personally, like, okay, you need to, as an employee or somebody that works you need to wash your hands every hour at a minimum. You're in contact with a customer, you're going to do it again. Then, when we're buying, like non-touch soap dispensers, things like that. So, just doing all these different things. But what I read something yesterday about, that really wasn't definitive, but it talked about what responsibility do we have if an employee gets sick, and will workers' comp cover it but do they have, there was questions, do they have to prove that they got it at your office? Things like that. So it's just worrying what liability we might have when we do open.
So the question of liability is really
Right.
the forefront one. Yeah, no, it's just good because we're kind of noting that down as to what some of the needs are that people are looking for as they're moving forward. So
Mhm.
Does anybody else have anything that they're concerned about or that they're struggling with on the protection regulations?
Yes, one of the things that we've done is we're an essential business, so we've been open the whole way through. And then what we found was at first, it was making sure that our customers were comfortable, and of course keeping our employees safe. But one of the things I also realized is as the state and the county has been putting out these directives, is I've had to go to each and every employee and ask them, hey, are you okay with this? And you'll find that different employees will have, obviously there are different concerns, you know, whether it be their age group, whether it be, you know, childcare, their, you know, whatever the case. But I think it's good to touch each and every one of the employees and make sure that you're addressing all their concerns. Because there's a lot of questions out there about returning back to work, and a lot of misinformation out there as well. A lot of misinformation.
Sean, how are you handling the misinformation piece with your employees?
So, you know, for us as leaders, I mean, we just have to make sure that we're informed and educated and consistent, you know, with our messaging all across. Is, you know, make sure, you know, I try to make sure to stay ahead of things as opposed to, you know, being behind. So that's helped, and it's instilled confidence, I think, with our employees, with our overall mission of keeping them safe as well.
Great, great. Does anybody have anything else they'd like to add with that? I don't know if Michelle, if you are on there, but the issue of childcare, I think, is one that is very tricky right now. And there's been a lot of questions regarding how do you protect parents and children, and as you're moving forward on that.
Yeah, we've definitely been reading up on a lot of these requirements. And so some of the changes we're making this year is, obviously we're keeping the group small. So now it's 12 kids per group, and there's that maintain stability for at least 4 weeks. So keep the same 4 weeks together. And we made it clear to the parents that they can't be absent for a week and then plan to come back. So it's like, once you leave, you can't come back, right? And then also, you know, we're going to limit visitors. And so the plan then is, parents used to, you know, come in and kind of linger in the foyer. And now we're going to have them drop off their kid outside, and the parents won't be coming in.
Yeah.
Also, the parents won't be touching the attendance sheet either.
How are you doing that?
Well, our plan is, I'm going to print out the attendance sheet and just have the staff mark each child off. Instead of, because in the past, we'd have a clipboard and the parents would pick up the pen and sign their child in. And now we're not going to have them touch the clipboard or the pen or even step foot into the building. I think the issue regarding face coverings, I'm going to have my staff, you know, wear masks and face coverings the entire time. And I've had parents ask me if kids will be required. And I say, you know, kids under the age of 12 are not required to. And quite frankly, they're not going to want to. But obviously every child's different and every parents are different. And so I'm going to leave it up to the parents to decide if they want their kids to wear a mask. But I know personally with my own 3 kids, they hate it. They hate wearing it even for like 10 minutes.
Yeah.
They have to wear it all day.
You're lucky you can get them in there for 10 minutes sometimes. Exactly.
And parents have, you know, have valid concerns, right? They want to know, how are you going to maintain physical distancing? How are you going to, you know, keep the space clean, right? How frequently are the kids going to be washing their hands, and, you know, how do we minimize the sharing? And so we definitely, you know, I find it's easier to hop on the phone with a parent and say, here's what we're doing, you know. And my husband got one of those electrostatic cleaners that kind of spray into the air, and it'll kind of zap all, you know, just because if we're going to constantly clean, it's a much faster and a more effective way of cleaning.
Oh, that's interesting. Can you just for another minute or so, just so that's an electrostatic cleaner that cleans the air? Yeah.
I know nothing about it. It just came in the mail yesterday, but I can definitely find the link that he used when he purchased it and share that.
It's like an air purifier, an electrostatic air cleaner, or?
Well, when he showed it to me, it looks like something you wear on your back, and you kind of just spray.
Oh, interesting.
And I think the way he described it to me is, you know, if you're cleaning the doorknob, you're spraying, you know, in one direction. And this allows you to kind of, when you spray the doorknob, it kind of like encapsulates the entire doorknob, all surfaces, not just the front facing surface. So you're cleaning the whole entire.
And that's what airlines are using now. when between flights, they spray the whole plane down.
Interesting.
Interesting. Because I've also been hearing, because I actually rent an office at WeWork, which is a co-working space. And just some of the concerns about going back in there is that you've got the circulation of the entire building. And the issue regarding the entire building, if you can be safe in your space, but if you don't have access, I mean, the air is circulating from everywhere. So that's, you know, it's good to hear about that, and HEPA filters or what, you know, whatever people are putting in there. But I have heard that there have been some solutions there. Anybody else have any other things on PPE?
I would just quickly mention that for those businesses that have, you know, the door fronts the sidewalk, we are talking to the city about a special program to make it very easy to get a little encroachment permit to, for instance, put a small table out in front. So take up a little bit of sidewalk space where you would have, maybe that's where you do your interaction with your customer. Maybe that's where you have a mask or a hand cleaning station or something, but just provide a little room outside of the enclosed space to help comply.
Great.
And Todd, to clarify, that's actually, I clarified with our community development department, and that's always been available. So we don't charge a fee for encroachment permit for the use of the sidewalk. We haven't gotten any applications, I think, because people aren't able to open yet.
Or they're just doing it.
Or they're doing it. Yeah, I know I haven't been walking down Solano Avenue recently, but please reach out to our community development department if you're interested in getting an encroachment permit. It's kind of on a case-by-case basis. Definitely, we need to make sure there's room for people to get by on the sidewalk. So that's why it's case-by-case. But they're excited to help businesses come up with these kinds of pivots, in Sean's words.
And what's the process now? You email or do you call? I mean, how do they
You can
connect with
call
the
or
city now?
email.
Yeah.
Yes. If you go to our webpage, our community development department on the right side should have information. And if you're sending out anything to the people who are on the call through the chamber, I'm happy to share that with you directly, Todd. But the phone number is 510-528-5760. And the email address is com-dev@albanyca.org, but it might be better.
Community development
Yeah.
Great. Thank you, Claire. Good.
Great. Thanks, Claire.
Yeah. Let's move to our last question, which is, what could innovating my service offering look like now? We've been talking about that a bit, and Michelle and some of the others have been, Andrew piped in, talked about what, and Richard, you were talking about some of the things in your office with the sneeze guards and, you know, what possible solutions, some tactical solutions for the PPE. Is there anything that you, anybody can add in about what are some solutions? What are some of the approaches that you might be trying to take that's different, that you didn't think of before? Has anybody had any aha moments or you know, shifting to what we might create differently? I mean, it might be even doing a different business altogether. I think Todd talked earlier about selling groceries, you know. I think that there's been some folks who've been adding in new service offerings. I heard about one dry cleaning store who was adding some things in. I don't think it was in Albany, but I think that people are trying to get creative in ways to establish cash flow, to be seen by their customers, and to expand their customer base. So whether you've seen anything, or maybe you could share something that you have seen that you think that can be quite good.
So, I mean, I've been using this time, as we had the shelter in place, I've been getting out to different communities and different counties, and seeing some of the counties that have opened up or have loosened up some of their restrictions. I would tell everybody is to get out and see some of these counties, because some of the energy and some of the sense of community coming from these places is pretty awesome. I must admit it. It's not the doom and gloom that, you know, some of us expect it to be, but there is again a greater sense of community, and a greater sense of of being re-energized, just because of maybe the new services, just because of everybody, you know, sitting outside and having a big community space where everybody's kind of interacting with each other, yet still respecting the social distancing rules. So.
Mm-hmm. Mm-hmm. Great. Hi, Lisa. Thank you for turning on your camera. It's good to see you there.
Yeah. And well, Suzanne, I also want to say that the dry cleaner that you mentioned, that is in El Cerrito, and being the part-time manager of the Chamber of Commerce, I just wanted to acknowledge that you noticed them. Great American Dry Cleaners, and they're right next to Trader Joe's, so it is almost Albany. And yeah, they a few weeks ago started making masks and going into mask making big time and selling them. First, they're also giving them away, so you can buy one and they will donate one, and they've already given close to 4,000 masks away to
Wow.
first responders. So that has definitely gotten them a whole new set of customers too. And they became new chamber members, which is great, because it's been hard to connect with with getting new members. Was just seemed like an impossibility in the last couple months, but I was glad to report that they joined us as chamber members too. So yeah, they're getting new clientele with the mask making operation, and I hope that their dry cleaning business, of course, and washing business will keep on going.
Sure, sure. And because we had talked earlier about reestablishing a customer base or recrafting that customer base, for what you're doing with El Cerrito with the chamber, I mean, have you all been trying to think of new approaches for that? Or it's just really tough?
Yeah, at the moment, our resources are pretty limited. So we've just been mainly concentrating on being relaying information from the county and the federal government to our members and to the community. Sort of, we haven't been in the position to be able to offer too much as far as actual other approaches for the businesses, or creative ways for them to stay afloat. It's a little bit beyond our capacity right now.
Yeah, sadly, chamber membership isn't top on the minds of a lot of the business people right now. And we do what we can. Yeah.
Well,
it should be.
I was going to say, I mean, I think that's a really good point, is that right now getting support, getting connection and building, for how moving forward, this is kind of the time to have, people to lean on, to try to have, to try to create that. So.
Which you don't need to be a member to lean on us, but we appreciate it.
Right. Yeah, it's the same here. We published a list of all restaurants and cafes, whether they were members or not, and just said in the beginning whether they were doing takeout and delivery and that sort of thing. We were just trying to cover everybody, whether they were a member or not, to give them a boost.
That's really great.
Yeah. But I do just also quickly would say what Richard was talking about is a concern to me too, about responsibility going forward. And for the small businesses, I can't imagine that all these compliance things will be an additional burden, cost burdens, and that really starting to irk me how that might go. And I don't want our businesses to have to be doing temperature stuff like thermometers. I mean, they're not in the roller skate place is not in the health business. And so hopefully it won't come to that where people have to take your temperature and the businesses have to give people a thermometer to go to a store. I just hope it doesn't come to that. Anyway, that's a separate thing I've been worrying about too. Kind of.
We did actually buy thermometers too.
Oh my God.
We don't know whether we're going to use them, but we thought that might be coming, so we bought them in case.
If they're required, it's going to be harder to get them.
Right.
Yeah, we haven't gotten them yet.
Well, there you go.
Yeah.
That's what I mean. I don't think it should be required, you know, for the business to have to do that. It's just so much of a burden and encroachment on people who aren't even trained to do all that kind of stuff. And I don't know. That's a separate.
Well, and now for everybody too, been looking for this stuff. You know, you try to buy something that you would find in a business, for example, for the hand sanitizer. We have 3 separate offices, and if we bought the commercial versions of them from like a restaurant supply store or something like that, it's $1,000.
Wow.
To get the stand, to get the dispenser and the cleaner, it's $1,000 for 3 offices. And you know, and I mean, hopefully, like in, you know, less than a year, this will be done. You know, or a year later from now, all that you spent that money and you're never going to use it again because, you know, the vaccination's here or whatever. But
yeah, it's just huge burden.
Mm-hmm.
Yeah.
A lot of money.
And I think, Michelle, you were going to say something. And Jeremiah, thank you for joining us in your car with your mask. Very inspiring.
Oh, regarding the temperature, we're going to make that a requirement at our program, which is as soon as the kids arrive, we're going to take their temperature. And then also, you know, basically screening questions, right? Whether or not the child has been exposed to anybody sick and whether or not somebody at home has been exposed. And I think we're going to do a temperature taking probably 2 or 3 times a day.
Mm-hmm.
Yeah, because there's also guidance around what do you do if there's a child that's unwell and how do you isolate them?
Mm-hmm.
And then there's a contact tracing, right? So I think we want to, so that's our plan. And they have contactless thermometers. But I read somewhere where even with those, you should still wipe them down after every use.
Sure.
I think even with the thermometers, I think pretty much, I mean, it's just for what we know about the disease or the virus, it's just a false sense of security anyway, because you can still be, again, asymptomatic and transmit the virus. I think one of the biggest things that we have to look at, you know, basically the basic CDC guidelines, you know, just making sure that, you know, it's basic, you know, soap and warm water. And, you know, some of the other little stuff that we need to do.
Right. I'm going to, if anybody has anything else they want to add at this point, because I think it's about 3:15. And what I would like to do is move it over to one of the last things we wanted to do was just to ask, is there, how can the chamber, how can the association, the Solano Avenue Association, how can the city be of assistance? And we just wanted to open up the floor and just invite you to give some ideas of what you would like to see, or from your perspective, what would be helpful for you?
I think they need a change of leadership at the Solano Avenue Association. No. On that note, I have to go though. I'm just...
I was going to nominate Todd for the chamber president.
Oh, wow.
Here we go.
Well, I mean, as a representative and somebody that gets a ton of email from Alan, I think a lot of the stuff he finds and sends out has been very helpful.
Yeah.
When it comes to the association. So
there you go.
read it and use it. So
It's great. That's great.
So I would just remind everyone that the chamber, the SAA, and the city are having weekly meetings. So if there's something that, you know, these 3 organizations working together can help you with, this is a great opportunity to kind of, you know, join that conversation a little bit.
Great. Anybody else have anything they want to add? We just wanted to kind of wrap it up and.
Sure, I'll add something. I wanted to echo what Sean said about the temperature taking in terms of a false sense of security. I know we beat the thermometer issue to death, but I do want to say I have some direct experience with an organization that struggled with taking temperatures at the door. They thought maybe it's a sign of distrust to their staff, like, you know, you're sick, but we think you're still going to come to work, so we need to double check you. At what point do you actually tell somebody, hey, we need to step aside and talk about your health status because you're at 99.8 or 101.5 or 103.2,
So
whatever the radio
100.4 is the
station,
official number.
whatever radio station, is there an actual
100.4. And I actually had a question for Michelle, if that's different for kids, because kids do tend to run a higher temperature. So I was just, but
Good point.
So there's a lot to it. And then when you pull somebody aside, is that a violation of HEPA law? And now people think that there's something wrong with you. They pulled somebody aside at the door and now they're not at work. Does that person get the paid day off? Is that a vacation day? You're the one that requested they go home. So there's so much about it. I think it's a dangerous road. And I just love the term pivot. It's great that we've brought it back into our vocabulary. But one example that I wanted to talk about earlier was an organization that Todd brought to our attention that does displays at conferences and trade shows. And they're using their same technology, their same vendors, their same tooling, and the same staff to set up plastic partitions in restaurants and other places that allow the lack of displacement of air, or air control, I guess you'd say, which is awesome. And then another interesting story that I heard this morning was, you know, most people, when they get the letter from the ADA or the city saying that their place is no longer wheelchair compliant, which usually involves a button at the door that you kick with your foot to have the door open. A lot of these features that we considered to be inconveniences about a year ago are now actually sought after via these ADA installation companies who used to be the devils, who are now going around and are overbooked. So they too pivoted in a different direction.
Right. Well, we're going to have to learn that whole term of pivot in a really healthy way. So, I mean, we might not like it, we might be burned out on it, but this is all about pivoting to make it move forward. So, I want to turn it back over to Todd and to everyone, unless Claire, as from the city, if there's anything you might want to add.
I just want to say one thing. I wanted to mention, it's come up a couple times. Michelle mentioned it, but I feel like it came up again. This idea that there's a lot of misinformation or conflicting information out there. And to Michelle in particular, but to all of you, I urge you to follow Alameda County's guidelines in particular. That's mostly, I mean, the city's putting out a lot of information. We're trying to condense that in a way that's more user-friendly for you. So please subscribe to our e-news as well, and check out our website. But I think Alameda County is the agency that we're deferring to in this, and you'll hear things from the state that won't necessarily be relevant for us. So please go to them, including looking at their shelter-in-place order. I think there's a lot of confusion right now because people have this assumption that the shelter-in-place order expires on May 31st, but it actually doesn't. They put out another order. They didn't do a great job of telling anyone about it because it doesn't have an expiration date. Yeah. So we are in, if you don't know that, I'm sorry to be the bearer of bad news, but we're in a shelter-in-place it's not indefinite. It will end. It will slowly ease. But I know I heard some rumors today that things are going to lift on June 15th. I'm pretty sure that's just for the state. That's not for Alameda County. So please read the shelter-in-place order. And I apologize if you're having customers who are getting other information, but if you can just send them to the county's information, that's my recommendation. And I'm sorry that it's such a confusing time.
And I would just bookend on that. Just you know, keep in mind, you know, Alameda County and the 6-county group is working together, being a little extreme, but it's working. Our numbers are remarkably low for our population. So it really is being effective. It's just, it's hard, but it's being effective.
Alan, I saw you shaking your head on something. Was there anything you wanted to add on that?
I was just affirming everything Claire said. The shelter-in-place order does not have an expiration date. The people who designed it are the Alameda County Health Department, and that's exactly who we recommend people listen to. They are the governors at this point for our area.
Mm-hmm. Mm-hmm. We've got a really, really robust public health department and throughout the Bay Area, and we're really lucky. And there's some history behind that as to why it is so strong. So it harkens back to the 80s. So very important. So Todd,
so the AIDS epidemic?
Yeah. Yeah. So there was a real robust, from my understanding, that there was a very robust public health protocols that were put in place back then. And so that's one reason, from my understanding, why we were able to, why our part of the country was able to move into it so quickly, is because we've had that background, we've had that experience. And from my understanding, Fauci, who's been at the national level now, was involved with some of that. I could be wrong, but I think he was. But it was at that point in time that those 6 counties came together and put things in, protocols in place, because they had to do a lot of closing of certain establishments, things like that. But we had some background to build off of, and we were very fortunate because of it.
All right. Well, I don't really have a whole lot to add. I would say that I believe everybody connecting here has a way to contact us, either through Alan, the SAA, you heard through their email, or through the chamber directly. But if there is anything you would like to see the chamber provide, or that you could ask us to kind of talk to the city about or whatever, you could probably contact the city directly. What do you think, Claire? Do you think that'd be okay? I maybe. But we're all happy. Our ears are open, and we want to learn how we can help you. Jeremiah, did you want to add something?
I can finally hear now.
Oh, there you go. Oh, very good. Well, okay. Well, thank you, everybody. Just want to sign off now. No, go ahead, Jeremiah. Did you have something you wanted to say?
Please.
I just wanted to listen to what you were talking about, but I just finally figured out how to listen. So.
Well, it'd give me about a day, probably maybe Friday. This will be up on the chamber website if you want to go back and listen to it again. And I do the job of indexing it by time, so you can look at topic and just jump to that part of the video.
Okay, great.
Yeah. So I would thank everybody again. Thanks, Claire. Thanks, Alan. Oh, sorry. One more thing. Jennifer's going to kill me if I don't mention this. Jennifer, the president of the Salon Association, has been texting that she's not able to speak. Her phone connection's poor. She wanted to remind everybody, and this goes along the lines of a lot of things that we've mentioned here, is one of the things you can do right now today, even if your business isn't open, but spruce up the front of your business a little bit. Make it interesting. There are people walking along the street. So if you're going to be offering something new or something different, well, now's the time to let people know, so they, even if you're not open yet, they can look forward to it. But people like new things, they like change, and if you make something that's eye-catching, that can help you when you do reopen.
Well, if I can just add to that too, and being the town skeptic, people assume the worst. So when you do have some messaging up there, it just tells people that you're still here, you're alive, you're healthy, your family's healthy, and that you care. Otherwise, when people don't, they just see a dark store and it hasn't looked like it hasn't changed in a while. They just assume the worst, which is,
those are really, really good points, because it just shows activity, it shows interest, and it shows leaning forward. And I think that's of everything, and wrapping this up, as we are looking at what is the new normal, I think we need to really take advantage of this time to just say, how do we make our plan? But letting people, communicating with people that we are here and we will be back.
Very good. I think that's a great way to end this. All right, everybody. Thanks to Suzanne. Thanks so much, Suzanne. Great job. Appreciate it. Thanks, everybody. And I think we will close this out.
Great.
Goodbye.